Hello and welcome to the RCNi Nurse Awards 2020, delivered on behalf of the RCN to showcase the clinical expertise, commitment and compassion demonstrated by nurses throughout the UK. This year is extra special as we are celebrating what nurses do for people from all walks of life and at every stage of life worldwide throughout the International Year of the Nurse and Midwife. But at the beginning of the year, who would have predicted how nursing would need to demonstrate its value globally through its committed professional response to the pandemic? So before we meet our 2020 finalists, let's hear from some of our Nurse Award winners and finalists about how they are meeting the challenge of COVID-19.
It's very difficult to talk about the positives when you think of COVID, when you think of what you've been through. I don't think any of us could have comprehended the level of stock we would need in a month. We would get emails from suppliers saying all stocks were being diverted to the NHS. It was almost like we were forgotten.
We were all just very frightened about what it meant and what it would mean for our working patterns and bringing it home and passing it on to loved ones, protecting ourselves. The challenges were looking at the best way to facilitate end-of-life care that was dignified and met the needs of the department as well as the needs of the patient.
We've had people come to us that believe that they have found the cure for COVID, that drinking bleach would cure COVID. We've had people present to us who were redeployed from one area of healthcare and kind of straight into an area that they were unfamiliar with, without preparation, without support, and they have been traumatised by what they've seen.
It changed everything about our way of working. It just completely turned it on its head.
We did lose staff across our footprint during COVID. So we created a flag to go over the condolence trolley. We've had all staff playing a guard of honour as the staff are being taken to the mortuary. So although it's been really, really tough, we need to show, we really, really do care.
What's supported us are the families. They've sent videos, they've done fun things, they've sent care packages. It's helped us look at things in a different way, particularly with technology. We've done staff clinics, we do family clinics, and kindness has really been evident across all of our care homes. Kindness from staff, commitment from staff, but kindness from the community and families as well.
Our patient feedback that we got was amazing. The patients loved being cared for by us. People came all together and it created such a lovely atmosphere. There was like a sense of unity for that we wanted to fight the pandemic.
When a hotel place came up for somebody, we were able to visit them on the street. We could symptom screen them, stabilise their drug use as well in lots of cases. Yeah, we saw real improvements in health, which were amazing.
We take handprints and lip kisses and photographs of tattoos. That's what we do. Free compassionate work beyond anybody's expectation.
What a remarkable response from the nursing profession to an unprecedented challenge. Now it's time to celebrate what nurses deliver for individuals, families and entire communities day in and day out. Before we meet the contenders in the Innovations in Your Specialty category of RCNi Nurse Awards 2020, let's hear from our sponsor, Samir Sharif, founder and CEO of Impulsis.
Hello, my name is Samir Sharif. I'm the founder and CEO of Impulsis Inc. Impulsis Inc. is a technology company working closely with the Royal College of Nursing over the last 5 years in innovating their digital products. We're honored to participate in the 2020 Nurse Awards and thrilled to present the Innovation Award for all the nurses contributing to their field in innovation. I want to wish every participant and the finalists best of luck in this competition. And I want to thank every nurse for their relentless work during the pandemic.
Thank you for supporting these awards and the nursing profession. Let's meet our finalists.
High rates of infant deaths in Wolverhampton are being addressed by our first finalist, the city's 0 to 19 service. Its education programme for Year 12 students and teachers, raising awareness of risk factors, has been so successful it has been rolled out through the city's schools. Our second finalist, Anna Waddington, was so frustrated watching young people die needlessly from knife injuries in her emergency department that she started teaching life-saving skills to those at risk. Teaching sessions are now delivered by 150 nurse, doctor and paramedic volunteers. Angela Woodley has revolutionised dermatology services in the Outer Hebrides, using technology and her advanced practice skills, slashing waiting times. She has transformed the care and experience of patients with suspected skin cancer with timely referrals and consequently better outcomes. Next, led by Fiona Tynan, the bladder and bowel nursing team has transformed continence care of people in hospital and the community in NHS Lothian, improving people's quality of life and at the same time saving money on unnecessary continence products. Our penultimate finalist is the Prison Healthcare Northern Ireland team, led by Denise Lyons. They co-produced a comic book with young people in custody, highlighting the dangers of drug misuse in prison. It has proved extremely popular in the prison and community services. And last, but by no means least, we have the Whittle Hall Care Home Study Team. Its research into the impact of a 5-minute activity for patients with advanced dementia before their meal found all but one gained weight, meal times were calmer, and there was a marked increase in positive behaviour. Thanks to our sponsor, Impulsis, for helping us highlight all these innovative projects delivered by nurses UK-wide. But the judges have decided their winner is Anna Waddington. The judges were blown away by Anna's innovative work and hard-working approach and felt her project should be replicated across the health sector.
Congratulations on winning this prestigious award, Anna. I was especially impressed by your efforts to build relationships between young people and healthcare professionals and the wider community. What a fantastic example of modern nursing's impact in the International Year of the Nurse and Midwife. And that brings us to the close of the Innovations in Your Specialty category of the RCNi Nurse Awards 2020. The awards recognise the very best of nursing, and you can find the winners of all our categories at rcni.com/nurse-awards. Thank you for being a part of this celebration. Before you leave, please take a moment to remember the members of the nursing team who have died during the pandemic.